In such cases, you can accept, no problem, okay? But if you accept newcomers, they will not know to mute and all that.
Okay.
Yeah, it's cool. So good evening, good afternoon, good morning. Just check whether we are on YouTube. Yes.
Good evening, Father.
Good evening,
Good
Father.
evening, Father.
Good evening.
Good evening, sir.
Very good evening. Yes, you can keep interacting. I wish all of you go to the YouTube comment space and put some messages over there so that we will wait 2 more minutes for them to join us. However,
Excuse
we have
me,
got-
Father.
Yeah, please.
I tried many times to start the videos. I don't know. I can't
Okay,
do
okay.
that.
Yes, sir. Okay, no problem. As of now, we can go on. An exception.
Oh,
Yeah, Vinita, right?
yes, sir.
Yeah. Okay. Yes. These restrictions are for your own safety because a lot of spammers come in and create problems, disturb the sessions. Yes, just greet the people at YouTube comment space. Let them feel at home. Yeah. At YouTube, you can just type in where are you from. I love EduSkills, or I love EduSkills OET, or like I love OET, and some hearts emojis coming. Yes. The more you repeat I love OET, the more you enjoy learning. Yes, hearts are coming in, emoji, smiles. Welcome, everyone. Good morning, good afternoon, good evening. Just type in good evening or good afternoon, good morning, where are you from, so that I know what you require, morning or afternoon or evening, or in late midnight. From Mangalore, yes. Vinita, yes. Good morning from UK, yes. Good morning. Good afternoon, yes. Love Schools from UK, yes. Good morning. Good afternoon from Saudi, yes. Good afternoon. Alfonso, Ranjini from Kerala. Good evening, good afternoon. Good evening, yes. Yes. Good morning. Good afternoon, yes. Yes, Beulah. Hi, I'm happy. I can't see you. You can see me, but I can't see you. Yes. Good afternoon, yes. Right. So, sir, at YouTube, we will allow you later if you want to enter Zoom. As of now, we are going to start the session. So we have closed admissions to Zoom classroom. If you have any concerns, like and subscribe. Yeah. Yeah, Render is saying in the YouTube comment space, like and subscribe. If you love our mission, just press the like button. We see only 14 likes. Does it mean others don't like? Yes. Come on, just click the like button. If you can share the link to your contacts, please share. Today's is a very, very important session, especially the beginners must attend. Yes, Ireland is Anasinos. Good evening, yes. From Qatar, yes. Good afternoon, Kenya. Yes. All from UK, good morning.
Yes, Acha, good morning.
Yes. There are so many from UK at the YouTube comment
Acha,
space. Yes.
Acha, can I raise one thing?
Yeah,
I saw
please.
your one video, like you said regarding the functional weight, like hasn't, hadn't, like that.
Okay.
So after I saw the video, like especially in the UK, like all the British people, they never
Yeah.
speak like that. The functional weight, like hasn't, hadn't, like that.
Yeah.
So it's like the previous video you said that don't study the OET for the exam, study for the life.
Yeah.
Exactly, I agree, totally agree with you, Father.
Yes.
Really appreciate your work.
Thank you. Thank you.
Because like if you go to any shop or anything like that, because you said like the could is meant to be the speculation.
Yes.
Exactly. If they're saying that okay, it could be like that.
Yeah. Yeah.
Really appreciate, Father. Really appreciate. Thank you very much.
You are most welcome. You are most welcome. Actually, the more you are competent, for example, in India, you will say, just imagine, yesterday somebody was not in the session. I asked someone else, where was he? So he says, imagine that he had been to Mumbai. Okay. Indians will say, he had been to Mumbai. But it is just, he'd been to Mumbai. He'd been to Mumbai. Because we are taught this grammar. So we are concerned about grammar. He had or have. So had, then be to Mumbai. So we stress on grammar. Usually in normal communicating English, you don't never stress on grammar aspect. So instead of saying he had been to Mumbai, we say he'd been to Mumbai. He'd been to Mumbai. And definitely if you are thinking of moving abroad, you need competency. Just OET will not help you. I know since decades I am with these people. I know people who have come back to India because they could not communicate properly. They found it very hard to cope with, or they were demoted. Demoted, like what is the opposite of promotion?
Dem depromotion.
Demotion.
Demotion, Father. Demotion.
Demotion. It's not depromotion. Demotion. So when I said demoted, some are blinking. Okay. Demoted means promotion, demotion. Yes.
Acha, especially in your old video, like each your words is really helpful for like daily like activities, everything. So you are
Yes,
doing a good work, Father. Thank you very much.
Yeah, most welcome. Yeah,
I
most
like
welcome.
long videos, long lengthy videos especially because the method is really different and you can get each and every point there.
But the problem is people are not interested in long videos at all. Now the sessions, if you attend long sessions, you understand
Long
everything in connection
Yeah,
with
yes,
the
Father.
strategies and all that. But you, from the analytics, I can make out the maximum duration. View duration is 6.5 minutes for any of my videos. The videos which run into 1.5 hours or 60 minutes, the maximum duration is 6.5, which means majority skip after 5 minutes or 2 minutes or 3 minutes. Yeah, people just watch short videos. Academic videos are known as lean back content. Lean back means you have to lean back on the chair and watch long. They are not like reels. We call it lean back content. Yes, Gohar, you raised your hand. You wanted to say something?
Yes, I want to ask some comments about your videos. It was really fruitful, and I'm just to recommend all my colleagues and my friends. If they are talking about OET, so many of them it's abroad. I send the links, a lot of them. But this is a great opportunity for me. It's my second time
Okay.
to do in Zoom, and
Yes.
really, you are the one. Your video is the one to motivate me for OET. I really appreciate your work. Keep
Yeah,
up
thank you.
the
Thank you.
good
Thank you.
work. Thank you so
Kind
much.
of,
Greetings
kind
from
of you. Thank you.
Pakistan
Thank
to
you. So
everyone.
kind of you. Where are you from?
From Pakistan. I'm from
Okay.
Pakistan.
Okay. All right. All right. We have the greatest number as
Greetings.
of now. We have students from 36 countries, but greatest number is from UK, then Pakistan, then Nigeria. The analytics shows that way.
but before this, a friend of mine, I was asking them then because everywhere this OET center, coaching center, and a lot of business, and without hesitation, he sent me your link, and with that I started, and I'm not the one way you say you love OET, so definitely you will move forward. But
Yeah.
somehow when I just got a time and I'm just doing it, and I really I learned a lot.
Yeah. It's not only OET. Whatever you do, you must fall in love with it. Even your medical profession, whatever you do, unless you are able to fall in love with your profession, your learning, you will never enjoy life. No?
Especially you mentioned OET love, so that's why I'm just mentioning.
Yeah, sure. Definitely. Yes. And English is something beautiful. Around 56 countries have first language as English. So wherever you go, whatever you do, English is going to be an asset in your life. If people are to Zoom, YouTube Live, are you ready to go?
Yes, Father.
At the Zoom classroom, we are waiting for your consent. Just type in ready. So let's have a minute silent prayer.
Good morning,
Again, welcome.
Father.
Good morning, good afternoon, good evening, wherever you are from. Yes,
I'm
welcome.
from
Yeah,
UK, sir. Actually, I want to know that do we are we starting the class in YouTube or Zoom, sir?
you are in Zoom now, right? That's why you are
Yeah,
able to
yeah.
speak to me. We are
Yes,
on
sir.
both. We have connected both. For the reason
Okay.
is this: many of these people who are regularly attending, sometimes they have duty. Maybe sometimes
Okay.
they are engaged with something, they are not able to come to the real classroom, like or the Zoom classroom. So at least they can listen to or see, watch, and listen passively, or when they are traveling, all those things. No, that's why we connected to YouTube as well. Yes.
Okay. Thank you, sir.
Yeah. So welcome again to Edu Skills OET Medici. Our mission is to make you fall in love with OET. Okay, the whole learning process is going to be enjoyable. Have some snacks or juice or whatever you love, coffee, tea, and just at your reach so that you can enjoy the journey. And keep interacting at the YouTube comment space. Any concerns, admins will bring to my notice, or those who are at the YouTube Zoom classroom will announce. Once they see your concerns, we will respond to that. And if you're watching this on YouTube, kindly consider subscribing to the channel, give us a thumbs up if you like our work, and share to your contacts so that we reach out to maximum number of OET aspirants, especially those who are financially and emotionally struggling to crack OET. Our mission is assisting people who are really financially struggling. Okay, so this is a absolutely free platform. We don't charge for any of our services. Please don't fall prey to some of the spammers saying that they are from EduSkills OET. And today we have a wonderful session on OET reading. When I say reading, listening, ultimately all these four subtests competency goes together. And today we will be focusing on reading. At the same time, we will show you how to apply the same strategies in listening. And let me share my screen and just respond. Even without my asking, you can respond in the YouTube comment space, whether you can see my screen so that we go faster. Okay. Are you able to see my screen?
Yes, Father.
Yes,
Here at YouTube comment space, I am concerned. Here I can make out you can see, but at YouTube comment space. YouTube, am I visible and audible? And can you see my screen? Just type in S in the comment space if you can see at YouTube. Yeah, visible, Father, yes. Visible, right? Yes. And OET step by step. So we are dealing with cause and effect language. If you remember from the previous sessions, as normal, I have some problem with my system working. It will be slow. So we'll learn some patience. Okay. So we are dealing with the cause and effect. We have seen both B as well as C, and this will be the last segment for cause and effect. Then we'll be going into, we have seen now out of 4 texts, we have seen cause and effect, problem solution, and today we will be seeing comparison and contrast as well. Cause and effect, reading part B. Okay. Let's yes. We'll look into this text. Hope you can read. Is it readable? Or those who are using the phone, you can zoom, okay? Because I can't highlight if I put it in bigger screen. Okay, what discovery have scientists made about possible causes of schizophrenia? Tell me, what are the hedging words? Those who are at YouTube can type in the comment space. Those who are here can shout out, no issues. If you have background disturbances, please don't on your audio. If you are cool at your background, please shout. So what are the hedging words?
Discovery, cause of schizophrenia.
Possible causes,
Discovery,
Scientists.
discovery,
Causes of schizophrenia.
causes of
possible causes,
schizophrenia. Causes, yes. Causes of schizophrenia or causes, okay. And sometimes you'll have to think of possible also. Okay, adjective. And schizophrenia is the subject, right? So option A, certain cells cannot move across the blood-brain barrier, affecting how the brain functions in relation to hallucinations and delusions. What are the hedging words?
Cannot
move,
Yeah, cannot move.
Blood-brain barrier. Hallucination and relation to hallucination and delusion.
hallucination and delusions.
Delusion. Okay. This is only for your purpose. Okay, you can highlight anything and everything, no issues, whatever helps you. But as you go on, improve your competency, you will have to highlight lesser and lesser. Okay. Then option B, certain cells cause inflammation in the blood, affecting how the brains function in relation to hallucinations and cognition. So since you have highlighted there,
Inflammation and cognition.
yeah, inflammation.
Inflammation
of
the brain function.
Yes. Inflammation in the blood. Okay. Next, option C, certain cells move from the blood into the brain to alter how it functions in relation to cognition and delusions.
Cognition and delusion and
move cannot move from the blood into the brain. Brain to alter
from
Move.
the blood.
Yeah, move. One is cannot move, one is move.
from blood.
The other is move.
And what do you understand?
Opposite one.
Opposite one will be the answer.
Yeah.
Other one we can eliminate.
Both are opposite, so one will be the answer. So we can eliminate B.
Eliminate B.
Okay. How simple and cool. When you
Cannot
highlight
move is move from blood.
yeah. Now we have eliminated, these people said, I don't believe them, okay? If there are beginners and all, they said, because cannot move and move, there are two opposites among the options. So these people shouted, the B has to be eliminated. Since I'm an obedient servant, I have done it. Don't believe them. Only by your practice, you have to confirm it, okay? Yes. So smile at it. So we have now only two options, okay? If it is in reading part C, you will eliminate two other options. So you'll have only out of 4 options, you come to two options, which we call in Malayalam Puttaten principle. Okay, that's a beautiful tip. Elimination strategy says, I have taught you 7 elimination skills, out of which the 4th one says, if there are quite opposites, straight opposites in the options, you can eliminate the other 1 or 2. Okay, one of them must be the right answer. So, coming to, is somebody interested to read this, the passage? Just listen, okay, where you are can find something connected to these 2 options. Please.
Blood cells could hold the key to understanding schizophrenia. Australian scientists have made a remarkable discovery about what is lurking in the brains of people with schizophrenia, giving them new clues about what might cause the illness. Using new molecular techniques, Professor Cindy Shannon showed a particular type of immune cell was causing inflammation in the brain. Her research found the cells could squeeze through the cracks in the blood-brain barrier to get into tissues and start affecting how the brain functions. That was confirmed where she did blood tests on people with schizophrenia. Those who were suffering psychosis had double the level of inflammation compared to the patients who were not psychotic at the time of testing. We can study the white blood cells in living patients and try to find how this relates to their symptoms, their hallucination, their delusions, and their cognitive problems, she said.
Any idea? Anywhere?
Squeeze through the cracks in
Yes,
blood-brain
Father.
barrier.
Squeeze through
It
the
can
brain,
Yes.
through the cracks in the blood-brain barrier. So C is the answer.
Through the in the blood brain.
Now, from the hedging word, keywords in the question, you know, you are asked about a possible cause. What causes, right?
Yes.
What is the cause of schizophrenia? And discovery, you have the words discovery here in the topic sentence. Anywhere else? Synonyms, all the same
Research
word.
found.
Yeah, research.
Yeah, research
Found.
found.
Research found. Yeah, found means again, found means discovery. Yeah, so you see, it clearly comes here, the hedging word. The cells could squeeze. Could is again saying possible.
Possibility.
Not,
Possible.
yeah, possibility. Could is the modal verb. Later we will learn it. The beginners, don't worry. That also tells you possible. That's why we have highlighted possible. The word possible, yes. So that also tells us there is answer. The modal verb also signals. Okay. And now you said this is the answer. But then let's analyze. And I'll tell you repeatedly, I'm telling you, getting correct answer, right answer is not our concern at all. Your scores are not at all important, but scores are important only when you do the mock test. Otherwise, scores are not at all important. Maybe you can do the things in within the time given for the exam under the exam conditions, but take any amount of time. Time and score is not an issue. Don't worry about those 2 things. Now you see, one more thing I want to tell you about this inflammation in the blood. This is a trick they play in so many, so many of the questions. In the text, there is something to confuse you.
Yeah, immune cell.
Yeah? Inflammation,
Double the level of inflammation compared to the
In the brain.
here you see,
brain.
sounds looks like same. Inflammation in the blood, inflammation in the brain, but they are not same. Okay? Sometimes certain cells cause, there is also the cause word. So in the question there is cause, so you will be, possibly you can be misguided. Do you understand what I'm saying?
Yes.
Certain cells cause
And
inflammation
it's
in the blood.
about question. It's
Yeah, yeah. About possible causes. Here there is a certain cell cause inflammation in the blood. Here you see of immune cells who was causing inflammation in the brain. See, brain and blood. They're entirely different, but when you read casually, it sounds and looks like same.
Yeah.
And I have seen, I am telling this from my previous experiences, there are so many students, learners who have selected that answer as the right answer.
Yes, sir.
Okay, so beware of those things. Anyhow, we will go into the analysis. Just a sec. See, research found could squeeze through the cracks. Can you identify any synonymous or synonyms in the third option, C option, and here?
Yes, for the squeeze through the cracks in the blood-brain barrier, the certain cells moves from the blood into the brain. So this is synonymous.
Yeah, and the squeeze is the synonym of move. Okay, it, how the brain functions. It functions. Brain is referred as it. They're also synonymous. The referent used is it in the option, third option. We'll look into it. This one I said, dangerous thing, dangerous trick they play. See, that was confirmed. Soon after the answer they're saying that was confirmed. Again, found and confirmed. Second confirmation for your answer. Soon after the answer they mention it. Sorry. There was something, Australian scientists have made a remarkable discovery about what is working in the brains of the people with schizophrenia. Again, this topic sentence speaks about the cause of schizophrenia. Now, what is the difference between psychosis and schizophrenia? You have done your placements in what you call psychiatric setting, right? Psychosis means symptoms. Psychosis means symptoms. Schizophrenia is a disease, a condition. Okay, so that's why those who are suffering psychosis had double the level of inflammation compared to patients who are not psychotic at the time of testing. That's why I have striked it out. Okay. Now let's see the paragraph structure. If you remember, we have started the whole segment step by step with the paragraph structure. Heading is there. Then you have, after heading, you have topic sentence, which contains what might cause the illness, the controlling idea. What might cause the illness? They are going to explain the cause of schizophrenia. So that is a controlling idea. Then trick played, option B, inflammation in blood. And text says inflammation in the brain. Okay, and paraphrasing of option C. Correct answer option is, this is paraphrasing of option C. Complements within commas, within brackets, after colon, hyphen, all these things are complements. Don't worry, we'll be explaining it, I guess, a separate session. Speculation, future tense versus question stem, found, past tense. Let's see the paraphrasing. See, squeeze through means move. Discovery, found. Now, start affecting, alter. And brain, the brain, it. Discovery, synonym is found. Move, squeeze through. Alter, start affecting. It, brain. See how many words they use synonyms and synonymous. That's why I said synonyms and synonymous are the paraphrasing. These three things are the most important things for your competency. And from the blood to, can you read that? I can't see. What is the last line? Please,
From the blood into the brain.
Into the brain. To the brain, yeah. I can't see the last line. That's right. Through the cracks in the blood-brain barrier. Yes. Okay. Synonyms plus synonymous language. What is paraphrasing? If you know synonyms and synonymous language, synonyms means one word given, another word given for one word. Synonymous language means a group of words substituted by another group of words. Paraphrasing means one sentence presented in other words. So if you know synonyms and synonymous language, automatically you know paraphrasing. So what is paraphrasing? Synonyms plus synonymous language. Okay, this, as we said, these are the synonyms. Okay. Yes. Now, question stem option C. Let's do the analysis. What discovery have scientists made about possible causes of schizophrenia? Option C says certain cells move from the blood into the brain to alter how it functions in relation to cognition and delusion. Always see that you read the question stem, that is the first part of the question, and the answer option together. In the initial stage, when you practice, read the question stem, then read answer option A. Then again, read the question stem, along with it, read answer option B. Then again, repeat reading the question stem and followed by answer option C. That's why I have written like this. So what does the text say? Just to show you the paraphrasing. Her research found the cells could squeeze through the cracks in the blood-brain barrier to get into tissues and start affecting how the brain functions. Sorry. So this, you can see the similarity. This is how synonyms and synonymous language used to paraphrase. This is the paraphrasing of question stem and option C. Okay, synonyms, synonymous language, and paraphrasing. Synonyms means words with the same or nearly the same meaning. Happy means joyful, means content, means cheerful. There is slight difference, but they all are synonyms. All these three are synonyms of happy. And big, large, huge, enormous, all these are synonyms. Here we have seen in every question, there will be so many synonyms. Now, synonyms could be phrasal verbs, look into, investigate, cut down, reduce, keep on, continue, point out, indicate, all those things. Expressions or phrases with the same or similar meaning, synonymous language. Expressions or phrases with the same or similar meaning. She died, she passed away. Let me know, inform me. These are synonymous expressions. Can I help you? Do you need assistance? Okay, synonymous language. From the blood into the brain. In the present passage, this is the synonymous language used. From the blood into the brain. Synonymous is through the cracks in the blood-brain barrier. And paraphrasing, restating ideas using different words or structures. Meaning preservation with rewording. Rewording is done, but no change in the meaning. That's what paraphrasing means. Pollution affects the environment severely. The environment is seriously impacted by pollution. This is paraphrasing. Same sentence, wordings are different, structure is different. Okay, she passed the test. She succeeded in the exam. Meanings are same, right? So you should have this analytical mind as you read. Answer option. Just see, the answer option says the vocabulary range of the student is assessed in the OET reading test. And the reading passage states the lexical resource of the OET candidate is assessed in the reading test. Vocabulary, lexical resource. Student, candidate. Okay? Yes. So that's how they paraphrase. Now, this is how they have paraphrased our present question and the text. We have already seen it. See, phrasal verbs could be something like carry out, synonymous, conduct, look into, investigate, turn down, decline, put off, postpone, bring up, mention, find out, discover. You have seen in this present one, find, discovery was said, found. Find out, discover, set up, establish, rule out, exclude, bring forward, reschedule earlier. So there is a spelling mistake, establish, it should be ESTABLISH. Okay. Are you okay with the cause and effect thing?
Yes, Father.
Yes.
The same strategy used for listening B as well as listening C, okay? So we'll check one text, one audio from listening B, okay? We are not going to practice it. That's why we'll be just listening and reading, okay? Reading, and we'll identify the cause and effect language here. If I can set you to the question, let me see. I have highlighted it because we are not going to practice it today. Now, what is this? Now read, see, you hear the manager of a care home for the elderly talking to the nursing staff. He says that errors in dispensing medication to patients usually result from. So cause and effect language. From the question itself, you can understand. When they say, he says that errors in dispensing medication to patients usually result from. So what must be the answer?
What is the
Cause must be the answer.
Effect.
Results from. Result of. Result of or results from means cause of something. What is the cause? So answer should be a cause. Let's check it. With that in mind, try to listen to this, okay? I'll just try to play it. Listen and read the screen, okay? We'll do it together. Listen, read. If you find something, if you have hard copy, you may not have it. It's cool.
Question 26. You hear the manager of a care home for the elderly talking to the nursing staff. Now read the question.
We have already read it, so you have it in the mind.
Now, a quick word about the administration of medication. It's great to see how carefully you're all following the new guidelines, and thanks to this, error rates, which were always below average anyhow here, have dropped by 40%. The surveys we've done also throw up some interesting findings, like mistakes being more common in the morning than afternoons or evenings. We're not sure why, but there's a clear pattern. Also, we know that being disturbed for any reason while working out and preparing doses is a common reason for mistakes. So please, try and avoid distracting your colleagues while they're doing this. Finally, we must be on the lookout for drug interactions, side effects, and patient sensitivities. Fortunately, we haven't had too many problems of this nature, but the care needs of the vast majority of our residents are often quite complex.
You're mute, Father.
Thank you. Thank you. Sorry. See, I was so excited about the this audio. Last part, you see, this is the trick they play in listening. Especially in IELTS and TOEFL, you have a lot of this type of questions. You see, finally, we must be in the lookout for drug interaction. Sorry. Finally, we must be on the lookout for drug interaction, side effects, and patient sensitivities. It looks that is very important, right? But next sentence says, fortunately, we haven't had too many problems of this nature. We don't have that problem at all.
Yes.
They speak something very serious, then they say, we don't have that problem. Many others may have. So that's not our concern at all. We call it nullifying the effect. Nullifying the effect. So you should be very careful about it. They stress there and they, at the end, they say it doesn't matter. We don't have that problem. Okay. Now, what do you see? Cause and effect anyway? Cause or effect words?
Reason, Father.
Reason.
Okay,
Also,
Common reasons.
any reason.
I'm trying to reduce
Common
my speed.
reason.
Avoid or distract you.
Okay.
Disturb
Common reason for mistakes.
I'm coming. I'm coming.
Mistakes.
Let me come to. Okay. Now I can highlight. See, that's why I said cause and effect. If you know the nature of the text or you understand the hedging word in the question, immediately you can identify the synonyms of the same word. Where do you find it? Tell me the line.
Also, we know.
Also, we know that we disturbed for any reason.
Seventh line.
Reason. Reason. Okay.
Reason.
Reason.
The next also
While
reason, Father.
then that's a common reason.
Common reason.
Common reason. Adjective is there. Common reason for mistakes. So what is that?
Cause.
So what is the problem here? What is the cause?
Disturb.
You see the topic sentence, a quick word about the administration of medication. So the topic is, somebody was asking earlier, if there is no heading, what to do? This is a heading.
Preparing doses. Preparing doses.
Working out and preparing doses.
Sorry to interrupt. I think father had disconnected. Maybe the internet connection problem.
Maybe net problem. I think.
Maybe he will join back. Just give some time. I think still we are on live. By the time, if you have any question, you can ask.
Is there any discussion today at 6 o'clock?
Hopefully. If you are ready, we can do it now.
Yes, ma'am.
Are you ready?
Yes, ma'am.
Then
But
we'll
I didn't get the
take the
PPTs.
turn.
I didn't get any PPTs.
Send on the same day. I'll send it again, ma'am.
Okay.
Meaning, if you can give share option, they can share it from there.
Okay, ma'am. We'll see that. Now we need to do or?
No. We'll wait for the father.
Uh-huh. Yes, ma'am. I can give the permission for the share.
What?
I can give the permission for the sharing.
Yeah, because you are a host now. You can give.
But ma'am, today we have 3 people for
Be
discussion.
patient, YouTube live. Father will join again. And also there is a command, lots of disturbances, cannot understand what father is telling. So whoever having background noises, you can just make sure that not to interact if you have background noises.
Ma'am, in YouTube one comment it's written how B is eliminated.
B. If they don't watch elimination video, they cannot understand. If they are a beginner, if there is quite opposite is, means cannot move, can move, direct opposite is. So either of these two options will have one option will be the right answer for the question. So simply you can eliminate option B. Please watch elimination 7 steps in YouTube. If anybody has asked the question, how you can eliminate B, you can
Excuse me,
understand
can
from
I
there.
ask you some question, please?
Yes.
Because ma'am, we are beginner and can we watch the videos from episode first, second, third, fourth, like that, or can we just watch in between like a 14 or 15?
If you want to eat banana, what you will do?
Yeah, all right,
What you
ma'am.
will
Thank
do?
you. Because there are too many videos and like episodes 1, 2, or 21. Maybe sir is doing now 19 or 20, like this.
If you want to get a clear idea, if you want to know the platform, just start it from the beginning. Like watch 1,
Beginning,
2.
yes, yes,
Yeah,
yes,
go for video 1. You will know who is our mentor, what he has done, what he. So you can understand why we are encouraging to be with only one mentor guidance.
yes. Thank you. Yes, yeah.
You can watch repeatedly any videos, but to be have an overall idea about the
Yes,
platform, about our mentor and what is happening in the platform. Just go through from video 1.
yes,
It will not take much time, like 5 minutes videos, I think.
yes, exactly.
Yeah, and also you are not going to watch it again because you know who is mentor, what he has done, how many degrees he has got, why he has Dr. Father Saleen Joseph. You will get to know about him.
Yes. Thank you.
Okay. But if there is a content video, for example, he has explained any question, paragraph structure, repeatedly watch that video.
All right. Thank you.
No worries. And also I can see the message in YouTube comment I couldn't join the Zoom session. Father said earlier he will share the link after the session. You can join, you can take a chance. Minnie, are you there?
Yes, ma'am. Yes, ma'am. Just 1 second.
Can you call father?
Yeah.
Okay. Anybody is attending first time in Zoom? Hello? Nobody is first time. How far you are with your?
I'm first time.
Good morning, ma'am. I am first time attending the Zoom class.
Who is there?
I'm first time attending the Zoom meeting, but I used to watch YouTube videos.
Okay. So there is a couple of first timers. Okay. Good to know that. Who all are ready to join the discussion? Hello?
Yes, ma'am.
Who all are willing to join the discussion?
Today, ma'am, today discussion?
Any day. There will be every day discussion if one started.
Yeah, ma'am, I will be joining.
I'll be joining.
I'll be
I will
joining.
join, ma'am.
Is it like every day, particular
Namaste.
time? Can you tell me what time?
Usually it
8:30
happens.
p.m.
It happens at 8:30.
8:30 Indian time, right?
Yeah, Indian time. Everything in the platform in Indian time.
So that will be a Zoom discussion or how it will be?
Yeah, mostly we are planning in Zoom.
So how do we get the link?
You will get the link prior to the discussion, half an hour prior to the discussion.
So I can see in the
In the group.
WhatsApp?
Oh, you're from WhatsApp.
I'm there in the WhatsApp.
Are you in the Telegram?
Yes, I'm there in the Telegram also.
Yeah, so you will get it from the Telegram. Mostly they will share everywhere, but mostly they will share repeatedly in Telegram.
Okay, so that will be usually they'll be sharing half an hour prior to the meeting.
Yeah, prior to the discussion.
Okay, okay. Thank you.
Excuse me.
Yes.
Ma'am, father has a network issues. I'm trying to join back, so that we need to discuss something. Like that. That's it.
Eh, did you ask about discussion, or else we can continue the discussion if there is a people, and then we father can join.
So we can do that until father will come. At least one episode, one or two, only three persons are there, so we can do at least one. Remaining things we can do after the class.
Two person is there, ma'am. Episode 2 also Ranjini is there. She is I think presenting.
Are you ready, Anjali?
By the time,
No, we can ask her whether she's ready.
no, there is PPT
If
is
she's
there
not ready, how she
already.
will do?
No, already there is PPT already she sent. Last time it is ready.
She sent. I
Unfortunately,
don't know whether she knows to share or not. So we have to think in that way, Jaya. Ranjini,
Yes,
could you
ma'am.
do
can you
that?
send to Sister Mini?
Yeah.
Ma'am, just now
Yeah.
Jyoti Manager told her she is ready to start the discussion. She told like that, no? Am I right?
Yeah. Somebody said ready to
Yeah,
start the
Jyoti
discussion.
is ready. Already she is having the
She is
PPT.
ready.
She
She
told.
has prepared PPT also.
Ma'am, I am Ranjini. I've already sent the PPT to step-by-step group.
Yeah. Could you share it in the Zoom? If she allowed to share.
Yeah,
Do
ma'am.
you know how to share?
Yeah.
I don't know, ma'am.
Otherwise, you can send it to me personally, and then just give me 5 minutes. I'll make it the PPT.
Okay, ma'am.
Just who all are there? Ranjini, first episode will be with the
Ma'am, first episode Jyoti.
Ma'am, I can share myself if you allow me.
Yeah, she will allow you.
Okay.
She can prepare for Ranjini.
Ranjini,
You
just
send
send it to me.
all
No.
the things. You can send it
Yeah,
to the
ma'am.
mini
I will
Ranjini.
send.
Yeah, just send it now, and then she will prepare. She will share it here. Everybody knows about our father, our mentor. No. So here, Jayati is going to take that one, and she's going to introduce our mentor and father. Jayati.
Hello, ma'am. Can you permit me
Yeah, she will
so
do
that I
here.
can?
Yeah, she will do. Just give me.
Okay.
Dua, can you ask that question? What did you post it in the chat? I didn't read it well.
Ma'am, just
so-
I given the permission. Can you try now?
Yeah,
Okay,
Jayati, can
ma'am.
you
Yeah.
try?
Yeah. Yes, I got the permission.
Okay.
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 I think she given the permission, Jayati.
Okay, ma'am. Yeah, can you see?
Yes,
Can you see my screen?
It is visible.
Yes,
It is
your
visible,
name.
Jayati.
Okay, thank you. I extend my sincere gratitude
Yeah,
for
please
giving me this
welcome, Jayati.
opportunity.
I'm really happy that
Yeah,
you're
thank you.
willing to do. Thank you.
Thank you, ma'am. So I extend my sincere gratitude for giving me this opportunity to introduce my mentor, Reverend Father Saleen Joseph. It is an honor and privilege to share about a person who has been a guide, light, and inspiration, a true sculptor of my journey. So whatever I say maybe maybe less about him, but it's my privilege to introduce him. And 1 minute, I'm going to share my.
Okay, no problem.
Can I continue, Father? I have to stop.
Oh.
Hello, Father.
Jyoti, we can continue.
Hello. Okay. So, one minute.
The screen is not visible. Okay.
So he has, as a mentor, he empowers individuals to discover their strength, deepen their values, and grow confidently in their personal, academic, and spiritual journey. His guidance is rooted in empathy and integrity. Reverend Father Saleen Joseph continues to be a pillar of encouragement, offering thoughtful direction, spiritual insights, and steadfast support to all who seek his mentorship. So he has done his studies. Let us see his education. Okay, see his educational background. He has completed PhD at Tumkur University, LLB, Karnataka State Law University, Delta, Cambridge University, London, corporate communications, skill trainer, British Council trained teacher, IELTS trainer, OET trainer. Let me share my next PPT. Please bear with me. So, PGDCA, Manipal Academy of Higher Education, BA, MA, Mysore University, MSW from Kuvempu University, BTech, Comparative Religion, Urban University, Italy, and BPH, Western and Indian Philosophy, Urban University, Italy. Areas of expertise. 1 minute. Let me share my next PPT.
PPT we cannot see, sister.
1 minute, I will share once again. Okay. Can you see now? Can you see, please?
No.
Hello?
No.
Yeah. 8
No.
Jyoti.
Yeah. Areas of expertise and responsibilities held by Father Saleen Joseph are SDM College Ujire, teaching English language to graduate and undergraduate students, communicative English trainer to MSW students, editorial board member, SDM College PG Department Ujire, teaching communicative and business English to PG students, KVG Law College Sulya, teaching legal language, Unique Edu Skill International Beltangadi, teaching soft skill to undergraduate students. And let me share my next PPT, please. Please bear with me. So I'm not able to find. Just bear with me, okay? Sorry. Okay. Spectrum training students, IELTS, teaching communicative English, teaching business English, MHRS, legal assistance from farmer of Malanadu region, CALS, skills training and training in personalized education, BAR bar, Council Beltangadi, advocate, certificate trainer, master brain program, STM college member, BOS, STM college representation from industry, corporate and aligned area relating to placement. Then Young Communicators Club Students Coordinator, PRCI Mangalore Zone, ICYM Coordination of Youth Activities Diocese of Beltangadi, KVG Medical College Ethical Committee, and innumerous designations held by Father. So these are the designations which are held by our Reverend Father Saleen Joseph. So let's see our mission. Our mission is to empower each other and grow together. So let's keep this in our mind so that we can help each other and grow together. Thank you for the trust and the encouragement that from the platform to speak about someone who has shaped our values, our growth, and our outlook on OET. I am truly grateful for this meaningful opportunity. Thank you very much, all of you, for listening to me.
Thank you, Jayati.
Thank you, Jyoti. Thank you,
Welcome.
Jyoti. It was very nice.
At least somebody will have idea of our mentor and what he has qualified for. And the next person, Minnie, if things are ready, maybe you can carry on.
Ma'am, can I leave? I have some emergency.
Yeah.
Okay, ma'am. Thank you.
Yes, ma'am.
Yes, Minnie.
Hello.
Good evening, Father.
Good evening,
Good
Father.
evening. Yes, you put
Oh,
me out,
Father.
right? You sent me out of the platform. Yeah.
No, Father.
Yes, I had some issues with the network that I called the technician and someone made it. Cool. I think half of the people have left, right? No patience.
We know that, Father.
Eh?
We learned. We know that, Father. We learned patience from them.
Yeah. Is the YouTube running the same screen?
Yes, Father. Still it is.
Yes, Father.
Let me check. Shall we continue?
Yes, Father.
Yes,
Okay.
Father.
Father.
Where are we? Let me check. This is the one, right?
Yes, Father.
Yeah. So we have seen the cause word in the question stem, and we have come here. So let's check next slide. So the administration of medication is the concept here. So also we know that being disturbed for any reason we have already highlighted. Okay. Disturbed for any reason. Reason is cause. While working out and preparing doses is a common reason. So we found the synonymous words there and the answer is there in the same line. So please try and avoid distracting your colleagues while they are doing this. So again, they are stressing, as I said earlier, it was said, the studies confirmed it. Here they are saying, please try and avoid distracting your colleagues while they are doing this. More than this, how can they help you? Okay? Every time in the reading we have seen, they confirm, it is confirmed. Here they are saying, please, please, please don't try to avoid this thing. So what is the disturbing factor? That's the question is that. So the question is?
Interruption.
Of course, sir.
Let me play the full screen.
Distracting interruption.
Yeah.
Cause mistakes.
Yeah. You hear the manner of a care home for the elderly talking to the nursing staff. He says that errors in dispensing medication to patients usually result from interruptions while calculating dosages, a failure to check for patients' allergies, administering drugs late in the day. See, even from your common sense, even from our common sense, we can understand. Sorry, there is some problem. One sec. Let me take the focus more.
Interruption will conflict
Interruptions.
One sec, give me one sec. I'm trying to put in focus mode. Mini, are you the admin? No. Host?
No, it's a co-host.
Where is my focus not happening? Yes. Yeah, done. So I was speaking, someone else was coming on the screen. Okay. Interruptions while calculating doses, a failure to check for patients. That's what I was telling. See, he says errors in dispensing medication to patients usually result from. Do you think a failure to check for patients' allergy will cause dispensing medication errors? Administering drugs late in the day. If you administer the drugs late in the day, there will be errors in dispensing the medication.
No, Father.
Please mute, okay, if you have background distractions. Being disturbed, interruptions. Being disturbed, interruptions. While working out, while calculating and preparing doses. While working out and preparing doses, here it says, while calculating dosages is a common reason for mistakes. Before that, we have found the reason. Twice we have seen found reason, any reason, and common reason in the same answer sentence. Twice it is mentioned. So if you know the cause and effect nature of the text, result from means they are asking for a cause. Immediately you have to go and search for the cause or a synonym. Did you get the idea?
Yeah. Yes, Father.
Yeah. So this
Yes,
is
Father.
for, yeah, this is for both your reading as well as listening. I'm just connecting and showing you. So when you learn reading, don't think you are learning only reading. You'll also, when you come to listening practice, subtest, it will be very easy for you. Okay. The focus of the audio is administration of medication. Nature of the text or audio. Text or the audio is cause and effect language. The result from. Common reason. Scale, adjective, high. Okay. That's okay. Scale we'll see later. Reason, cause and effect language. Result from, reason. All this tells you this is cause and effect language. Okay, that is cool. Do you have stamina to go on for the next?
Yes, Father.
Yes,
Yeah. Yes. Like reading part B, comparison. Next is comparison and contrast language. Okay. Let's see what it is. As I said, types of text. Usually I never used to teach it because not needed. We'll have a basic idea. Then we'll go into the text. Comparison and contrast. The theory is not that important, but you should know what is comparison, what is contrast. And you know, contrast-based words. We will find a lot of questions based on this particular type of text. Comparison means identifying two things are similar. Contrast means identifying how two things are different. That's the basic meaning. And purpose of comparison and contrast. What is the purpose? One is evaluate different treatments or interventions. Second one, compare findings across studies, various discoveries, analyze competing theories, understand methodological variations, and synthesize information in literature reviews. That's not required for us. It's a common thing. Comparison words. As we said, cause and effect. There are words like leads to, results from, due to. So here also, comparison words. Similarly, likewise, in the same way, both, comparable to. These are the commonly used comparison words. Okay, contrast words. These are very, very important. You have so many answers just after the contrast words. As we go on, we'll teach you a strategy where you find answers after the contrast word. One is however, whereas, on the other hand, in contrast, unlike, differs from. Okay. Mostly you have however, whereas, even but you will have but. Okay, but also can be added to this list. This is just to give you comparison and contrast. What is the reading skill assessed here using this text? Identify two ideas being compared, track similarities and differences, infer the writer's stance, positive or negative, inference questions you will have. So from this particular text, you have two types of questions very often occurring. One is contrast word-based question. Other one is questions based on inference. Now, fourth one, evaluate evidence used in comparison, detect bias or selective comparison. Don't worry about the details of it, but general idea you should have what is comparison and contrast language. A group known as impatient patients are more likely to continue with a course of prescribed medication if. What are the heading words in the question stem? So there are beginners. This line, first line is known as the question stem, what I read just now.
Impatient.
Huh? Impatient?
Impatient patient.
Okay.
Likely to continue.
Then
More likely to continue.
more likely to continue.
If.
Okay.
Course of prescribed medication.
If.
Yeah. Okay. Yeah. Okay. Option A, their treatment can be completed over a reduced period of time.
Period of time.
Over a reduced period of time.
Can be.
Reduce the period of time.
Over the period of
It's possible to link
Or
the
reduce
treatment with financial advantage.
financial
financial
advantage.
advantage.
Financial advantage.
In short-term benefits are explained to them.
Short-term
Short-term
benefits.
Term benefit.
Short-term benefits. Yeah.
Okay. Is somebody interested to read this text? If you are using phone, zoom in and read. Okay, otherwise it will be small.
Medication adherence and impatient patients. A recent article addressed the behavior of people who have a taste for the present rather than the future. It proposed that these so-called impatient patients are unlikely to adhere to medications that require use over an extended period. The article proposes then that an impatience genotype exists and that accessing these patients' view of the future while stressing the immediate advantage of adherence may improve adherence rates more than emphasizing potentially distant complications. The authors suggest that rather than attempting to change the character of those who are impatient, it may be wise to ascertain the patient's individual prioritize, particularly as they relate to immediate gains. For example, while advising an impatient patient with diabetes, stressing improvement in visual acuity rather than avoidance of retinopathy may result in greater medication adherence rates. Additionally, linking the cost of frequently changing precipitation lenses when visual acuity fluctuations with glycemic levels, any sometimes provide the patient with an immediate functional motivation for improving adherence.
Okay. Now you see first topic sentence. A recent article addressed the behavior of people who have a taste for the present rather than the future. What does it say? This is the controlling idea of the topic sentence. That says there is a comparison between present and future. Taste for present and taste for future. Very controlling idea says the text is comparing two things, and the skill they are assessing in you is whether you are able to identify which is better, present or future. Present or future. It proposed that these so-called impatient patients are unlikely to adhere. See, here it is likely in the question stem. Here it is saying unlikely. What does it mean? Unlikely to adhere to medications that require use over an extended period. What is the other meaning? Now, if it is use over an extended period, they won't adhere to. They will not adhere to medication. The opposite is, what is opposite?
Reduce
period of time.
Yeah, so if it is short period, short-term project or short-term medication or short-term benefits, they will adhere. So there is the opposite given in the first sentence after this topic sentence. So unlikely to adhere means unlikely to continue with a course of prescribed medication. Unlikely to adhere means unlikely to continue with a course of prescribed medication. Did you understand? So once you develop the competence, there itself you understand. The categorically they say if it is a long-term thing, they will not adhere. They will not take the continuously medication. So what does it mean? If it is short-term, they might take. They are likely to take. Did you get that idea?
Yes, Father.
Yes,
Yeah.
Father.
So as you develop competence, what I'm telling you, you don't read much. Let's see now what is next. The article proposes that an inpatient scenario exists that assessing these patients' view of the future while stressing the immediate advantages. Stressing the immediate advantages of adherence. Okay. May improve adherence. May improve adherence rates. So likely to. Likely means may improve. Likely to continue. May improve. Adherence rates means with the course of prescribed medicine, more than emphasizing potentially distant complications. Distant, immediate. Distant, immediate. Every sentence speaks about immediate. Short term is better than distant or long term. The authors suggest that rather than attempting to change the character of those who are impatient, it may be wise to ascertain the patient's individual priorities. Again, patient's individual priorities, already they mentioned. What is individual priority? Short term.
Short term.
Okay. Particularly as they relate to immediate gains. See, again they are saying, particularly they relate to immediate gains. See. Then, for example, while advising an impatient patient with diabetes, stressing improvement in visual acuity rather than avoidance of retinopathy may result in greater medication adherence rates. Now they are saying if you are dealing with a diabetes patient, instead of saying about retinopathy and all that, tell them maybe your sight will be blurred. You will not be able to read. You will not be able to study. Immediately, what problems you will have. Additionally, linking the cost of frequently changing prescription lenses. Additionally, linking the cost of frequently changing prescription lenses when visual acuity fluctuates with the glycemic levels may sometimes provide the patient with an immediate financial motivation for improving adherence. Now they are confusing you here. The financial advantage is given in option B. It is possible to link their treatment with a financial advantage. Here what they are saying, here it is more likely. In the question sum it is more likely. More likely means the scale expression, right? More likely means most of the time. But here they say may sometimes. What does it mean? May sometimes. More likely, may sometimes is far below. They are speaking about financial advantage or financial motivation. Option B. Do you see that scale used here? If there are beginners, don't worry about it. You don't require it now. Okay. See, always, more likely, sometimes, may sometimes, never. All these are scales. Do you get me?
Yes, Father.
Yes, Father.
How beautifully it is written. That's what I said from the controlling idea itself, topic sentence itself, you have the idea that this is comparison and contrast. They are asking you to find out which is better. Which is better, short term or long term? And which is the answer? This must be the answer. Yeah.
Short
Again, yeah, short-term benefits are explained to them. And here their treatment can be completed over a reduced period of time. See how they are trying to confuse you between short-term benefits and reduced period of time. It is can be completed. Their treatment can be completed. What is the tense? Completed. What is the tense?
Past tense.
That is factual, already completed. Means they are speaking about something, it can be completed. But there, we are not speaking about completing, but they have to adhere to medication. Medication can be lifelong, right?
Yes.
So the meaning is different. So you see, more likely, here it is past tense. May sometimes, possible. Okay, so it's not right. May improve. Okay. So in short term, benefits are explained to them. That is the right answer. Just to tell you what is the nature of the paragraph. Did you get the idea? Like cause and effect, here you have comparison between two things and they are asking which is better. Which is Better.
Better.
Short-term or long-term benefits. Clear, right?
Yes, Father.
Yes. Now you see, I'll just give you one example from listening. Same strategies are used in listening as well. See, short-term priority to 5 shagas, long-term projects. That's a heading, just I wrote. Dr. Robinson thinks the short-term priority in the fight against shagas is to, option A, increase I lost again. Where am I? Is the screen visible?
Listening comparison. Yeah.
Yeah.
It's verbal.
So listen,
I
okay?
see. And what can be done to combat Chagas generally?
Plenty. Researchers are working on improved drugs to treat it and a vaccine. None currently exists, but it takes at least 10 years to supply a new drug. Another idea is to develop the existing drugs in tablets of different sizes. That could and should be done almost overnight. What's currently available is designed for adults, even though infants often have the disease. There are also some very important programs using insecticides and other methods to wipe out the bugs that transfer Chagas to humans, but initiatives like those take decades rather than years.
Well, Dr. Jack Robson, thank you very much for speaking to us today.
What do you think? See, the comparison here is between short-term priority. Robertson thinks short-term priority in the fight against Chagas is. There are different options. Which is better? One is increase efforts to eliminate the insects which carry the parasite. So the hedging word is eliminate the insects. What is the hedging word in the question step? Short-term priority and fighting against Chagas. So the main primary hedging word is short-term priority in fighting against Chagas. So the first option A, increase efforts to eliminate the insects which carry the parasite. So eliminate the insect is one option. Option B, produce medication in a form that is suitable for children. Producing medication is the second option, which is suitable for children. Means transforming the present medication, whatever is available, changing the medication or making it suitable for children. C, design and manufacture a viable vaccine. So one is killing the insects. Second one is medication, changing it to doses suitable for children. Third one, vaccine. So 3 options are there. They are comparing these 3 options. Earlier it was 2 options in the reading. Now it is 3 options. You have to find out which is the short-term priority the Dr. Robinson is speaking about. Which is his priority? Where is he stressing? Okay, listen one more time and try to associate.
I see. And what can be done to combat Chagas generally?
Plenty. Researchers are working on improved drugs to treat it and a vaccine. None currently exists, but it takes at least 10 years to supply a new drug. Another idea is to develop the existing drugs in tablets of different sizes. That could and should be done almost overnight. What's currently available is designed for adults, even though infants often have the disease. There are also some very important programs using insecticides and other methods to wipe out the bugs that transfer Chagas to humans, but initiatives like those take decades rather than years.
Well, Dr. Jack Robson, thank you very much for speaking to us today.
Okay, now they are asking about short-term priority, means short-term. So there are several time, short, long, medium times are mentioned. Did you get the expressions or listen once again and identify only the time expressions, okay? short term, long term, medium term, whatever. Just try to write down the time expressions, nothing else. Just concentrate on the time expressions. We'll listen again.
Father, I can't hear anything. I can't hear the audio.
You see? Nobody can hear?
We can
Yes,
hear you, Father.
we can hear Father.
Okay, maybe you are
No,
at
Father.
your end there is some internet issue, ma.
No, I can't.
How many
Can't
can? Majority can hear, right?
Yes,
No,
yes, Father, we can hear you.
Yes, Father.
yeah, which means it's not a problem from here. Do you get me? I'll try again. I'll try again so that you can hear. Don't worry, otherwise we'll show you the script, okay? Those who can hear, just listen and write down the words connected to term, short term, long term, the years or periods mentioned, okay? Nothing else. Concentrate only on those things. Then we will find out which is short term.
I see. And what can be done to combat Chagas generally?
Plenty. Researchers are working on improved drugs to treat it and a vaccine. None currently exists, but it takes at least 10 years to supply a new drug. Another idea is to develop the existing drugs in tablets of different sizes. That could and should be done almost overnight. What's currently available is designed for adults, even though infants often have the disease. There are also some very important programs using insecticides and other methods to wipe out the bugs that transfer Chagas to humans, but initiatives like those take decades rather than years.
Well, Dr. Jack Robson, thank you very much for speaking to us today.
So what are the time expressions? Did you get any time expression?
Cannot hear the audio.
Can't hear the audio, Father.
Huh?
Did not hear, Father.
Can't hear the audio.
We can't hear the audio, Father.
Okay, I'll stop sharing and share it. I will stop sharing and share it again. Let me check. But some are saying they can hear, which means
Yeah, on the
Father, in YouTube we can hear.
YouTube we can hear the audio.
that's why always I ask you to connect both. Now some can hear here also, but I don't know what is the difference. Now it's playing here, not in YouTube. That's why always I ask you to connect both YouTube as well as Zoom. So if there is some disturbance in one area, you can connect the other. So can you listen from YouTube? Just sign into YouTube and listen. Because this is a very important practice, okay? It's basic. Sorry.
Audio is finished for the on YouTube.
Yeah, that's why I'm going to play it again. Now what you have to identify is just the time expression. Okay? Those who cannot hear, can you connect it to YouTube? If you can't connect both in one instrument, you can exit from this one. We'll admit you again, don't worry, from Zoom. But you have to listen, otherwise no meaning, right? You can connect both. You can just click on the YouTube link, then you can listen to being in the Zoom platform. If you have two instruments, just in the Telegram group, there is a link. No, just click on the link. You will join. Are you ready? Shall we go?
Yes, Father.
At YouTube, just say yes or no. Are you ready at YouTube? Non-current day. Yeah, at YouTube, some people have mentioned 10 years, overnight, decades. Okay, yes, Father. Okay. Yeah, please mute. Now you have to do two things. Some may not have done it, first thing, but then you can do it together. Write down these things. I'll show you one sec. Now you see, you have to write down eliminate insects. Just write on your notebook, eliminate insects. Number 2, medication. Medication in bracket, you write medication in a different form. In a different form. suitable for children, but you can understand that. Number 3, vaccine. You put dash in front of all these 3 options, and you have to write the corresponding time expressions, okay? In the audio, it will not be in the same order, so you have to check for all these 3 and listen to properly and write down in the corresponding. For example, eliminate the insects. How many years or what time duration is required as per the audio? Medication in a different form, what duration is required as per the audio? And producing vaccine, what period of time is required to produce a vaccine as per the audio? Listen, okay?
I see. And what can be done to combat Chagas generally?
Plenty. Researchers are working on improved drugs to treat it and a vaccine. None currently exists, but it takes at least 10 years to supply a new drug. Another idea is to develop the existing drugs in tablets of different sizes. That could and should be done almost overnight. What's currently available is designed for adults, even though infants often have the disease. There are also some very important programs using insecticides and other methods to wipe out the bugs that transfer Chagas to humans, but initiatives like those take decades rather than years.
Well, Dr. Jack Robson, thank you very much for speaking to us today.
Yes, thank you very much. You see, the order is simply put upside down. Okay? In the audio, in the question, you have vaccine, third one, but in the audio, you have first one. And the medication in a different form, you have second one. In the audio also, you have second. Third one, you have the first one, first option in the third one. So what is the duration required to eliminate the insects?
10 years or decades and
Decay.
Vaccination 10 years.
Yeah, decades
Decades
means 5. It can be 5 decades, 6 decades, 10 decades, anything. Okay, decades. Then medication in a form that is suitable for children.
overnight.
And vaccine.
10 years.
10 years.
10 years. That's very important. Now they are asking among these 3 options, time durations, which is the short term.
Medication overnight.
Overnight. And you can see later on when you are competent in the modal verbs, you know, 2 modal verbs are used there. Could and should. Could and should, something of that. Not 2 modal verbs. Listen once again with this idea, okay? This is how you have to listen, the 7-step listening.
I see. And what can be done to combat Chagas generally?
Plenty.
What is a synonym?
I see.
Used?
And what can be done to combat Chagas?
What is the synonym used in the question in the audio?
Can.
Combat. C-O-M-B-A-T. Combat means fight. Fight. Yeah, that is a synonym used. That's why I say synonym. If you are not competent in synonym, you will not get the thing.
I see. And what can be done to combat Chagas generally?
Plenty. Researchers are working on improved drugs to treat it and a vaccine. None currently exists, but it takes at least 10 years to supply a new drug. Another idea is to develop the existing drugs in tablets of different sizes. That could and should be done almost over.
See, could and should be done. That could and should be done. So stressing to giving 2 modal verbs. That's why I said all these modal verbs are clean signals. That is answer. That we'll learn later. Don't worry. Beginners, don't worry about it. Yes.
Night. What's currently available is designed for adults, even though infants often have the disease. There are also some very important programs using insecticides and other methods to wipe out the bugs that transfer Chagas to humans, but initiatives like those take decades rather than years.
Well, Dr. Jack Robson, thank you very much for speaking to us today.
Yeah, decades. Eliminating the insects means to prevent malaria. One suggestion is you kill all the mosquitoes. Everybody will be given 1 bat to kill the mosquitoes. How many years it will take? Hundreds of years. Second one is vaccine, which will take 10 years or more.
Yes.
Third one is changing the form of medication suitable for children, which happens overnight. 10 years, and decades, 100 years. So it's just like asking small children, if you understand, which is short term or which is small. 1 day, 1 night, 10 years, and 100 years, which is short.
1 night.
Yeah, that's it. That's it.
Wow.
As simple as that, if you understand. That's why you're playing it again. I want you to practice this way. Unless you understand, take only one question, listen again, understand everything. Then later you go to the script and the 7 steps listening practice. You must practice initially in those 7 steps, then only you will improve. Okay, you understood. So, Dr. Robin's things, short-term priority in the fight against Chagas is to all those things I see. The synonyms, fight against, combat, parasite, bugs, eliminate, wipe out, fight against, combat, short-term, overnight, eliminate the insects, insecticides, contrast, long-term, at least 10 years, take decades. See? But contrast word is there. That's what I said. That will be important. And chronology, another, could and should, 2 modal verbs. Sorry. Okay, 2 modal verbs. Another is the transition signal, chronological sequential expression given. Those things are not required if you know. Yes. And cause and effect, those we will not deal now. It will take long time. Synonyms. Okay. Procedural instruction, all these things have different synonyms. We are working on it. These are all from the material. We haven't taken anything from outside. We will be putting it into the ebook as we are working on it. Okay, everything will be included. But don't study the long list of synonyms published in some platforms. That will not help you much. Maybe it will help 5 to 10%. But the synonyms that you have to be sure or learning must be from the materials that you use, nothing else. Only keep a diary and write down all these synonyms. Okay. So these are the pages of our ebook. We are working on it. Yeah. Then diaries, you know, we have already said we will not deal with it now. You have diary of vocabulary. Okay. Words, family, synonyms, synonymous language, paraphrasing. Maybe you can take one book and keep different segments, or take different diaries or different books and write down small books. But then synonyms, synonymous language, paraphrasing, you can keep in one book, one segment together, because they go together. What is polysemy? Polysemy means one word having many meanings. English words often serve multiple functions. Context determines the correct meaning. Just to tell you why you need these diaries. The word round has 79 meanings. R-O-U-N-D. That word has 79 meanings. If you ask me what is the meaning of round, I cannot tell you. I'll have to say 79 meanings, because it depends in the context. So used as verb, noun, adjective, preposition, and more. The word round can be used as verb, can be used as noun, can be used as adjective, can be used as preposition, and they mean different. See, when it is used as verb, it has 26 different meanings. When the word round is used as noun, it has 19 different meanings. When word round is used as adjective, it has 18 different meanings. Used as prepositions, it has 9 meanings, and there are 7 special meanings. So 500 most used words in English have an average of 28 separate meanings per word. At least 28 meanings. Source, human behavior at work. Okay, this is the source, copyright. So that's why we tell you, you have to learn the words in the context, not the list of words. Okay, list of meanings will not help you. You will learn one meaning, but that will have 20 other meanings. So used as verb, 26 meaning. For example, round a number. Round is word. Round the corner. It's used as verb. Noun, some examples. A round of drinks is noun. Boxing round. Round means noun. Adjective. Round table is the adjective of table. Round face is the adjective with the face. Preposition. Walk around the building. Okay. Special use, come around, in the round, all those are special meanings. Just to give you an idea. Final takeaway is every word counts. Knowing how and when to use it makes all the difference. Okay. See. Like this, you'll have to write for the fitness, diet, and health vocabulary. You can write the meaning and one sentence from the context of your listening or reading text that you have practiced. What does overweight mean? What is obesity? So write that sentence as well, the meaning as well as the sentence where it has occurred. So you can have such word families in your diary. That really helps your competency. Then you should have the diary of scale. You are not learning it now. Just to tell you, keep all the scale words together. Okay. Lot of scale words, scale expressions you will find as you go through the materials as you practice. You have seen today itself many of them. I did not stress it because beginners may get confused. Okay. All these are scale expressions. I don't want to go to the details of it. We'll take in another session with examples. But I'm trying to draw your attention to the diaries, how you can write all the scale expressions in a diary. Now, writing down this helps you to develop a analytical skill in reading. Many foreign students do the OET test in their home countries. Reading passages, most overseas students sit the OET test in their country of origin. Are they same? Are the two sentences mean the same?
Most, no.
Hmm?
No.
Why? Many can be anything more than one. But most means it should be most, majority of them, more than majority. So see the synonymous language, overseas students, or foreign students, overseas students. Do, synonym is sit. Many and most are not same. They are not synonyms. Okay. They are scale. We'll come back to it. And diary of contrast words, diary of topic sentence-based questions, then diary of gist-based questions, diary of elimination absolutes. All these different diaries you can keep or a different portion of your diary. Grammatically incorrect options, elimination. 11th diary of the opposites, elimination of opposites. Write those opposite expressions and keep it in your diary. Questions on opinion, name-based questions, number-based questions, singular, plural, category-based questions, general and particular, emotion-based questions. All these diaries you can have. How beautiful. So many of them. Each type of questions, you can keep a different diary. So you can have 16 diaries, at least 14. So that synonyms, synonymous, and paraphrasing, you can have same diary. Does it make any sense? Some will be thinking, my goodness, who will do all these things? Okay. No patience to do these things, but people will learn for years and years and practice all the material. Okay. That's the difference. Yeah. Any clarifications? Anything that you want more explanation? Give me one sec. Yes. Yeah, come on. Yeah. Last time I had given an idea that you can have WhatsApp groups because some are not able to connect with the Telegram. You can have at least a small group of 5 students, learners, not from this platform. At least connect with 4 or 5 students. Then take in your WhatsApp group. You can add me as well. Then what you can do, you can guide them. That will help you a lot in your developing your competency. How do you guide them? Send them episode 1, 2, 3, 4, 5, 6 every day. We will give you that. Don't worry. Okay? In order, we are posting it in order. You can save somewhere and guide them. Then they will discuss so many things. You can send all of them to discuss in the main platform. Then we reach out to many people. That's what you can do to support the platform. Did you understand the idea? Last time I proposed, I didn't find any feedback. Anybody, you can connect and add them to the group and give them the resources. Sometimes they may not agree or accept, or they may not come forward and tell you the response, but they will use it. Okay, later on they will remember. Maybe after many years they will meet you and tell you, okay, because of you I passed the OET and I am here. There are so many examples of that. Now the people have started to go. Finished.
Yes, Father.
In a hurry. At last admins and me will be there. This is the problem. Otherwise, in December, I wanted to take some additional sessions, continuous sessions, but then people will not be there. Very few. And you can see many people here. 1, 2, 3, 4, 5 of us are admins here. Me and admins are here. So, and Shanmugh and all, he has passed their OET more than 2 years ago. So, we don't learn again. But then they are assisting us. What do you say?
No, Father.
The problem?
Every day I'm learning at least one new thing. Every day,
Yeah.
if I'm joining classes, I'm learning new things.
Yeah. Yeah, but then that feeling, that learning, that love for wisdom should be there, right? Love for learning. Otherwise, we can't. People
No,
who did not,
your
people who,
classes are very good, Father, because I can tell my experience. Like when I started reading, I was not knowing how I will do the part A with 15 minutes. But because of your trick, I'm very happy. Like I can do it now within 10 minutes. So I'm sure, don't disappoint it. We will attend your class and please continue taking classes.
but there are only very few people, Ben. And if you keep maybe additional classes, there will be 1 or 2 sometimes. So how do you think we prepare all these things, spend time? It's not easy. Even today's class I have taken because I'm an old man now, right? To prepare OETs, colorful and all takes a lot of time. It took
I
me at
can
least
understand your
more than 3 hours. If I don't prepare any PPT, you won't understand basic things. No, just by me saying in English, you won't understand. Again, I'll be going fast. So PPT will slow me down. Okay.
Understood, Father.
Yeah, but then you have to give up the selfishness and you have to invite. If each one invites one person, see, at least we are able to reach some people, because some people may not admit. You can add them to the group. They may not admit they want to learn OET because they are ashamed or they are not confident they can pass. All those issues are there. We understand. But then when we spend time, at least somebody should benefit, right? And today, I have sent the notice maybe 4 days before, right? The link and notice. I have posted it through thousands of you more than twice, at least twice to your personal chat. Then in all the subgroups and main group, Telegram group, repeatedly posted by admins and me. In spite of that, the people have a thinking that, okay, they can watch it later, but that itself is not enough for people. Only those who are competent can manage. If they are not that competent, otherwise I can simply make videos and upload it, right? I spend my time at my own convenient timings. I can make videos and upload, but that itself will not help more than 90% of the aspirants, OET aspirants. They need some guidance, real-time guidance. in the real classroom, at least virtual classroom. But then people don't understand. They write it again. They simply practice, practice, practice. See, now Shanmuga is back and she is attending sessions even after nearly 3 years after passing the exam and being in UK because she fell in love with OET. But majority of the people hate OET. That's why they don't want to think of OET. Once they pass, they will burn everything. They never think of OET. They don't want to come back and they get irritated. Recently, I have sent many messages to my admin panel. People were shouting at me, why do you send me link? I have passed OET. They don't want to see any links then. They don't want to see anything about OET. Since they hate OET, they hate me as well. I'm connected with OET, right? Yeah. So the best solution is to fall in love with OET.
Good. Good, Father.
How about creating a WhatsApp group? Let there be 3 people, no problem. But it's like gradually you will improve. We started this platform during Corona, this OET by Soumya Sham and 3 others, just 4 members. And it has reached to lakhs of people now, since a decade or so. So you can bring a small ministry. Let's do something for others. That will definitely give you more consolation, more peace. Later on, people will say, because of you, I'm here, or I could pass OET, all those things. Will you start one WhatsApp group and add me and send me a message? Did you understand the concept? You'll have at least 4 or 5 friends, no? Just add them. They can exit anytime. But then at least resources can go, because we are spending a lot of time, admins and me, to put them in episodes. First time ever. All the videos will be 1, 2, 3, 4. Now we are in the 23rd episode. It will run into 100 episodes. So anybody can start from fraction. Why we have started Know Your Mentor? Because the basic thing when you approach social media is at least you should know who is listening, who is teaching, and why. What is the competency of the person to teach OET? Because in the OET social media, you can find so many wrong things they are teaching. That's why one criteria I tell everybody, whoever you want to follow, just find out how are they qualified. There are girls who have never passed OET, but they make money just teaching OET. What do they teach? They themselves are not sure what is OET. Okay. So beware of those social media misleading things. If they are competent, fine, you can follow. Anybody who is competent will publish about their qualifications. If they are not competent, they will not publish their qualifications. Yes. So how many of you are ready to start one WhatsApp group? Just raise your hand virtually or physically. You can add me as well. When it's heavy, I will get it later. Okay, just to guide you in the beginning, I will. 1, Dr. Shabina Munir. Yes. 2, only 1 page stand. Yes, means stand. Okay. Valli Prabhakar. Lini Kevargis said yes. Indrajit Kaur to everyone. Yes means yes, he will start, right? Amanpreet Kaur, yes. Father, yes. Okay. Okay. Lalita, okay. Raise hands. You have an option to raise your hand, right? You know that?
Yes, Father.
Yeah. Just teach others, those who know, because I don't know what they do in the phone. I don't use the phone for the phone. Do you have the same settings? How to raise hands? Somebody teach, let everybody raise their putting in the message. I can't see. Only when it comes on the screen, I can see. If it passes, I can't see.
There is an option for reactions, Doc Father. So we can just click on that.
Tell them where it is in the phone. Actually, in the computer screen, I have on the lower part, in the middle of the screen.
In the mobile, it will be in the lower side beside chats.
Yeah, just everybody try to raise hands. Those who have raised hands in the message, because when you are going like this way, I can't see the message box. I can see only when it comes flashes on the screen, but I'll not be able to see. Okay, one. Now try raising your hands just to learn it. That's all. You have to click that react button. No, in my screen it shows like a heart. Okay, there you can click. There is arrow. Okay, and this. Hope you learned this. Anna Judas has done it. Elizabeth has done it. Okay. Elizabeth did it. Yes. Yes. Any suggestions? Dua is a newcomer, new face. Is it your name? Dua, D-U-A. Will you introduce yourself?
Yes, but it's so noisy, so I'm muted. So noisy.
Okay. Yeah, no problems. Now we can speak, no problem. Only during the sessions, there should not be any distractions. Yeah. Okay. Now the thing is, if you, otherwise I'll be taking up IELTS and other classes more. So if you are sure, you will have to invite some more people because we hardly have 20 people now. Next day it will be 15. Another day will be 10. People are interested, we can change the timings also because maybe after December 15th, 2 weeks, I have my regular schedule will not be there. You can have any time, 24 hours, any time as per your schedule, provided there are people. Okay. In the groups also, admins, you can give that suggestions. Time can be changed. It can be anywhere within 24 hours because my regular schedule will not be there. My students will be going for holidays for 2 weeks. Otherwise, I'll be going on other engagements. Within 2-3 days, if I come to know OET students require, I'll spare. But for a couple of people, will not be able to spend time because for other platforms, we'll have to. Where there are more people, we'll have to do. We have to choose the greater good always. When there are two good things, you have to choose the greater good. Okay. So it's up to you. You decide. The more you become selfish, lesser the lessons will be. Any suggestions?
Father, can I ask you one thing?
Yeah,
Is,
please.
is there any offline classes going on?
Offline classes are organized by the aspirants. Whenever we have offlines like December 2 weeks, October 2 weeks, and March 15th to April, May 2.5 months, we take up sessions. It is organized by the students in different places. I don't charge them anything, including my travel elements. I don't charge. I take up classes. We have taken 15 days, 10 days, 3 days in different places. Like Mangalore, we had a couple of times, like it was 2 weeks. Once it was 1 week. Bangalore, we had in Kochi, we had in Kottayam, we had in Kumaragam, we had in Chettikode, different places. That's all organized by a group of OET aspirants. I wish I am in India. You are okay, thank you. Yes, you are. Where are you now? Okay. Yeah. Offline, you can think of if there are at least 20 students, I don't mind coming and teaching you. We don't charge anything. It will be free for you. We don't require huge spaces. Just a room will do.
Okay, Father, thank you, Father. But
yes.
I'm sure is 20 members. I didn't tell everybody I'm learning. I'm learning OET because
you should be able to tell because people don't say because they are not sure that they will pass. One reason is that, right? The main reason is that. But if you are not sure you will pass, how can you pass? Because you are telling yourself, I will not pass, I will not pass. Even God cannot help. You should take that courage and say, I am going to pass it. Anybody can, if you try. That's the main problem. Somebody wants to communicate to each other. So just feel confident. I can guarantee you, you can pass. No issue.
That's
It
the
may
main
take,
issue. But I
yeah.
have some family issue also because
Okay,
if
okay. I
yeah,
can
so
understand. I
yeah,
can
so
understand. But some have exceptional issues, but majority don't want to tell anybody because they say, I'm not sure whether I'll pass. Within themselves, that they have the feeling. And if you have that feeling, it's very, very challenging. Because you yourself, you give a auto suggestion that you will not pass, you will not pass, you will not pass. You will never build up that confidence that I will pass. You keep on suggesting, your subconscious mind will feed you that negative impact, and it will be very challenging.
I have the same challenge also, but still, if I didn't understand one topic or something like that, oh, I think better I drop these things. I demotivate myself.
No,
But
it's
still,
like,
again,
yeah. The real classroom, if it is helpful 90%, means face-to-face real classrooms. The Zoom classrooms will be beneficial 70%. And recorded sessions will be beneficial maximum 40%. 40 to 50
yes.
maximum.
That's why,
That's the
Father, I'm
difference.
yeah,
Yeah,
thinking
that's the difference.
is there any offline classes like if anywhere in Kerala or in India is I am fine because I want to leave my kids with my parents because they are coming next week from UK, so I get
That's
2 months time. Yeah.
yeah, that's why people don't want to help each other. No, see, anybody can organize like anywhere, like no, even some people who have like, see, last time you might have seen when Avinash came in, just seeing online. Long back, he came and stayed with me. They were staying in a 10 to 10 room in my residence. We didn't have sufficient space. 8 of them were sleeping there, just
Oh my
spreading the
God.
bed sheets, just spreading the bed sheets. But he is a tech head of MHK now in America.
Oh.
One of the
Yeah.
topmost positions in America, the second biggest health company, MHK. He came here live in OET session and spoke because he saw me in online, so suddenly entered. They were in such situations. And we used to have continuously 15 to 20 students. We did not have any extra facilities. Nobody was bothered about facilities. No, they used to we used to get somebody to cook for them, and they used to share and pay just the amount of food. They used to purchase something and share everybody. Whatever is to be given to the cook and the things for rice and other things, what they buy, they used to share. No other fees. So it's not facilities, 5-star facilities that we require for when you are bothered about learning. Facilities are secondary. I have even slept in my car for 7 days when I was taking a training session because I knew they could not afford accommodating me somewhere. I never told them, but I slept under my car. It's cool. I don't mind. But I know many of them have now saved, generations have been saved. They're well settled in America, Canada, UK, Ireland, Switzerland, and many places. Yeah, for this year, that's what I'm telling. If there are sufficient number of students, somebody is asking, is there any next live session? If there are sufficient number of students, which I myself cannot go behind, you will have to support. If there are sufficient number of students, that's what I said, from 15th to January 5th, almost 20 days, except the Christmas holiday, 1 or 2 days holidays. Anytime I can have sessions because my students are going home. I will not have my regular schedule. But if this is not the thing, other schedules will come in. There are so many things to be done. But if you are interested, you have to take initiative. You have to motivate people in the group. Okay, you have to invite people and say, so many of us are here. I don't mind even taking a 10 days continuous, like 10-hour session. We have taken like that. Last year and all, we had full morning starting 8 o'clock till night 8 o'clock. People used to eat together. We used to drink, sitting in the room, taking small breaks. Yeah. because it needs a lot of discussion, like what we did with the Shagas, that listening practice. That's how you have to practice together. Then it helps you a lot. You will automatically enhance your competency. You will not even realize you are enhancing your competency. When you read next thing or listen to something, you will be very analytical. That's a natural thing. But if you keep on practicing without any strategy, without any scientific way, I don't think how it will help your competency. You will be satisfied. That illusion of competence will be there. I have practiced so many materials, so many months I have studied. Okay. Then illusion of competence means you feel you are competent. You are not. Yes. I'll just close down the YouTube live, okay? Then we can discuss if you want to. Oh, that has ended, right?
No, further live is still there.
But mine shows it is ended. Anyhow, I put it.